Yeah, thank you very much. I'm very happy to have the opportunity to talk with so many people in Finland. I've been in Finland a lot, and I think you have a lot of beautiful things in your country. And I learned a lot from your education system, and there are a lot of similarities, I think, in the Buurtzorg idea. I want to tell you about my history and my story, how I built Buurtzorg, and what's behind it. So you just mentioned leadership. I always have my thoughts about leadership. Usually I like to prefer to talk about craftsmanship, professionalism, and professional ethics. The six principles. When I started with Buurtzorg, I had the idea that you have to look at people from a holistic perspective. So it's important that you see people and families as from a holistic perspective. So, and being a community nurse, it's good that you understand where problems come from, how the social structure in the family is, and so on. So, and as you understood, there are many people who are working in healthcare or youth care in the audience. I also was involved since I think 1987, 1986 in youth care in Holland. And it's very important that you build a good relationship with the people you are dealing with. So that's the second cornerstone, I can say, or principle, trustful relationships. So, and it sounds very logic that you are dealing and building on trustful relationships, but the systems we build and also the way we are paid or financed sometimes, and the protocols makes it very, very difficult to focus on these trustful relationships. So, but in my opinion, if you don't build on trustful relationships, you can't achieve the best possible solutions for the people who you are dealing with. Also, good relationships with other people, not only with the clients, but also with the informal network. I think it's very important to understand the social structure of people and to have a connection with everybody who influences the situation you're dealing with. Also with the formal people, so the people who are in the formal network. So as a nurse, we had to deal a lot with GPs, with doctors, with physiotherapists, and so on. And it's good to build good informal relationships based on intrinsic motivation with all these people. If you look at the next cornerstone or principle, I think it's very important to focus on results, on outcome. In Holland, we build a very sophisticated system on indications and assessments, but that's not, I think, where it's about. It's about how can you focus on interventions and do the things which really create good results, good outcome. So when I started with Buurtzorg, we had to deal with a lot of products. So in Holland, we had for the community nursing, we had nursing special, nursing extra, personal care extra, and every product had a different tariff, a different price. And I said, because of this very fragmented way of dealing with healthcare, it had a lot of negative results. So we were not focusing on what is the problem and how can we solve it. but what kind of products can we deliver? And from the interest of organizations, the idea was, how can we deliver as much as possible? So it became more and more based on new public management. It became a commercial attitude. So I said, okay, let's focus on outcome. We introduced the Omaha System, which is a very, I think, it comes from the public health in the US, it developed in Minnesota in the 70s of the last century, so it's already 50 years old. But there have been a lot of research on this Omaha System, and it's really very supportive for all the professionals. The next part is the bureaucracy, and that's I think in many countries a big problem. So we spent I think too much time on signing things, on registration, on administration, on compliance and controlling and whatever. So my idea was, if we build on trust on nurses, and we say, okay, the nurses are intrinsic motivated. Okay, this is very helpful. The nurses, I see the slide myself now. The nurses are very intrinsic motivated to do the best possible things. No, I need the slide back. I'm not ready yet with the first slide. So we said we are going to separate the healthcare process and the back office process. So if nurses can spend all the time on patients, they will be happy because that's what they want. And it's also be very effective. We reduce the bureaucracy. So we build our own IT system, the Buurtzorg web, with some friends, which I think had a very smart and a very intelligent idea about the future. In 2005, 2006, we built our own, you can say your own Facebook with a lot of other functionalities. We said if we can share knowledge, information, if we can communicate by this Buurtzorg web, we can easily connect with everybody. And all the back office processes will be simplified. So we said we are going to focus on the primary process, and the back office processes need to be as simple as possible. So no HR department, no financial department. We need financial people, of course, but as less as possible. So try to avoid to make this very complicated and have a very simple business model. I will tell more about it later. And then the last principle is the principle of the scale of the neighborhood. If you have a small neighborhood you can take care of, you can oversee all the networks in the neighborhood. And as I told, I started as a community nurse myself in the 80s. It was very logic to have a small neighborhood where you could all take care for everything what was happening there. Good, then we can go to the next slide. So, and this shows when I started Buurtzorg, the policy in Holland on community nursing led to a lot of complaints. There was a big fragmentation of cure care and prevention. So everybody was doing parts of healthcare, and there was a big standardization of care activities. So very product driven, and so yeah, okay, now I see another screen. And the problem was that by this fragmentation, everybody was doing something. Patients were complaining because they had a lot of different caregivers coming at their houses. And I think also in youth care, it still is a big problem in Holland, that there are many people involved in one family. And you know, it's very difficult for people to build trust this way with all this many people, and every time clients have to explain again what the problems are, what they are asking for, and so on. If you look at the results of this, is that the quality went worse and worse because of the production mind. So everybody's talking about products and production. The costs increased enormously, and companies were trying to find low-educated people to do the activities because delivering much care against low cost was profitable. We had not any information about results, outcome, so we spent billions on care, and we didn't even know if it had any contribution to the quality of life of people. Professionals were very, very unhappy. A lot of people were leaving their organization. I think in those years, I think 55% of the community nurses left their jobs because they were frustrated. They thought it was unethical what they were doing. So that was around 2006. So the conditions were, I think, very positive to start something new. So the next slide, please. And what we started was Buurtzorg based on some simple principles. Yeah, the next one. So you see this very beautiful picture of this very strong nurse. I think it was a picture from the 60s or 70s. And we started to think, how can we simplify the whole organization, and how can we give the ownership to the nurses themselves? So being a nurse myself, I know that, you know, if you are responsible for people who are very vulnerable, you want to do the best possible thing, and nurses, especially nurses, are very good in organizing things themselves. So my idea is that if we create teams which are not bigger than 12 nurses, and they are working in a neighborhood of 5,000 to 10,000 people, even can be smaller, depends on the history and the geographic logic. But teams can be responsible for everything they are doing. So they schedule their own activities, they hire their own colleagues, they find their own office. In the beginning, it was funny to see that they were buying furniture in different places, usually by the IKEA. And usually that was the first test for the team, if they could put everything together without having conflicts, then everything went well in the team. So, but the idea was, okay, let's build our own network, let's connect them with the doctors. They will have the referrals from the hospitals and the doctors in the neighborhood, and they will take care for patients in a way that it's will lead to the best results. This is from the start. It looks very simple, but it worked, and we just had meetings with in the first year, 2006, 2007, with nurses, just to talk about how do you experience this, and what extra do we need to do to support it. And usually they said, we don't need anything, just give us the freedom to do what is needed, and things will be arranged. Okay, then we move to the next slide. So this was in 2007. It was an amazing period that just by starting with one team, and I started to work myself again as a nurse, it had a lot of attention all over the country. We got attention from television. We got the Minister of Health visited us, and she talked to the nurses, and she said, this Minister of Health, Jet Bussemaker, we still are friends now, and she said to the nurses, what do you think is different? What is different? You have the same patients, you are the same nurses. And then these nurses started to tell this minister that by the way they could build this relationship with the patient, the way that management was not involved and they didn't have protocols on time and so on, that they could do and the best possible things, and they could prevent a lot of problems. And this minister was really very touched by the stories, and she said, I'm going to support it. And then in those years after, it was increased enormously. We had all over the country, we had nurses who said, okay, we also want to do this. What do we need to do? So then I drove to Amsterdam, Groningen, whatever, all the places in Holland, little villages. I talked with the nurses in the living room, and I said, okay, how do we look at our professional ethics? What do we think? What is good nursing? And every time again, it led to a very inspiring evening with 10, 20, even sometimes more people. And the next day they said, okay, we are going to quit our jobs and we are going to start a Buurtzorg team. So I said, okay, that's very brave, because we just are starting and perhaps there are some risks. But no, they said, we think this is the best way to go. So now we have around 10,000 nurses, more than 10,000 nurses working all over the country. We have around 100,000 patients a year. And from 2007, we have very, very good results. We go to the next slide now. We also started with other services. And one of the most successful changes, I think, was a takeover from care workers who were doing the domestic care. So there was an organization who got bankrupt in Holland, and we got a request from the Ministry of Health. Can you support these people and start, perhaps they can start working in Buurtzorg. We called it buurtdiensten, so that means domestic care. And from one day to another, we had 2,400 care workers starting to work in self-organized teams. So first they worked in a very rigid organization with 6 management layers. They were instructed on the minute. We had a lot of meetings with these people, every time 100 people at once, and we put them around tables with 10 people who were living in the same neighborhood. And we said, do you think you can organize everything yourself? Most of these women, because most of them were women, said, okay, we think we can do that. And we said, okay, we will give you support by a coach if it's needed. And otherwise, you just do what you think is useful. We raised the salaries because they were very bad paid in this organization. And it became a big success. So at the moment, we have now 4,000 colleagues. They are very eager to do the right things. The clients are very, very happy. And the financial results are amazing. So by increasing the salaries, the tariffs stay the same, but by increasing the salaries, we got a much, much better financial result than the organization that worked before. So it's usually in Holland, the idea was that people with high education could work in self-organized teams. I can say everyone can work in self-organized teams. And everybody can behave like a leader when they feel intrinsic motivated and they feel the ownership. Okay, then we move to the next slide. This is the turnover. Before I became a nurse, I studied economics a few years. So I should have become an economist, but it was not the world I wanted to work in. So I made a very simple business model. And I said, if we have a simple business model, and if we have more money coming in than there is going out, then we are doing well. So Buurtzorg is a not-for-profit foundation. So I said, okay, it's money, it's public money, so we should be careful in how we spend it. At the moment, we have around 450 million turnover. The first year we started with 450 euro. So the increase was enormous, but we still have one sheet on where we have the costs, the income, and the results. So that's all. So we said with all the health insurance in Holland, because we have a health insurance system, but the health insurers in Holland, we negotiated one tariff. So we simplified the whole process, one tariff for everything what we are doing. And the costs are just based on 5 different posts, because that's in healthcare, it's quite simple. Most of the costs are made by the professionals, and that's around 90%. And then we have 8% back office cost, and we have 2% of the profit. So that's for a good financial result. Good. Then we move to the next slide, please. So at the moment, we have around, in total, we have around 15,000 people working for Buurtzorg. If you look at the structure, then we say we don't really have a structure. The teams are all working in a network all over the country, and we have around 50 people on the back office. So I already mentioned the IT system, which is very sophisticated, and we have people who are doing financial administration, the salaries. We have 4 ladies doing the salaries for 15,000 people, and so on. So it's very, very lean. Then we have coaches. So from the start, we asked the teams, what kind of support do you need? And these teams sometimes are struggling with colleagues who are ill for a long time, or sometimes there is a conflict. Sometimes they have problems with hiring people. And then the coaches can discuss with them what kind of things they could do to improve and to change the situation. So these coaches are they all have a background in healthcare. They all have been nurses, but they are very supportive. So they're not managers. They don't have any right for decisions and so on. So the decisions are made by the teams. There are no leaders in the team, or you can say everybody is a leader. So I think that's really the truth. And at the end, there are 2 directors. One of them is me, and we never had a management team. So we never had management team meetings. We don't make strategic plans or policy plans. We just do what we think is needed. And sometimes there is an issue. Then we think, okay, who can sit together to discuss this? And then we find a solution. So, and of course, in all those years with this enormous growth, we had topics which were difficult, sometimes with the health insurers, sometimes with the authorities, because everything what we were doing was different than other organizations. But every time we had an open mind, and we said, okay, let's just be open about it and talk with these people and explain it and ask if they think it's a good idea or not. And this led to more and more trust also in the system. So now we are in a stage that for example, the health insurers want to have a long-term agreement with us. So we said, let's work together as partners instead of fighting each other and thinking that we have different interests. So that's, I think, a big step, that we can do what we want. We can focus more and more on prevention, and it's supported by the system now. So we changed the system in time, and I think we are very happy in those years that we could see that focusing on good outcome, good healthcare at the end, but the volume we have, we changed parts of the system. We changed even parts of the law. Okay, we go to the next slide. If you look at some of the results, if you look at patient satisfaction, which I think was, of course, very important, we deliver less hours of care, and the patient satisfaction is the highest of the country. At the moment, it's 9.3, and it's always been the highest since we started. We also have very high employee satisfaction. We've been the best employer of the year 5 times. So it's not only in healthcare, but in total. The overhead costs are just 8%. And we got, without marketing, we got around 1,200 new colleagues a year. The next slide, please. This is our what we call the what I call the onion model. So we have the formal network and the informal network, and of course we start with the self-management of the client. So if we see what is a professional process that's not only focusing on the client, but of course that's the most important thing, but it's also focusing on how does the structure around the client looks like. Is it possible to involve volunteers or family members? How can we coach the client in a way that they can help themselves as good as possible? And of course, we have the formal networks like the doctors and the pharmacists and the physiotherapists. So, and we see ourselves as a part of a neighborhood and also part of an ecosystem. So it's all the time thinking about how can you create supportive networks, how can we empower people, how can we be adaptive, and when it's needed, we are there 24 hours a day. So the teams are available 24 hours a day, but usually people don't. If you organize and coordinate it well, they don't need support in the night, for example. So, but we have a lot of people who are very ill. We have a lot of people with who are terminally ill, with a bit severe chronic diseases, ALS, and so on. But we, by this preventive and proactive mindset, we prevent a lot of problems. This onion model is very popular and also in other countries. As you perhaps know, we already also are connected with the partners in Finland, but we are having partners all over the world. And I was surprised that this onion model was very popular in Japan, for example. So they were trying to find ways to build more on a community care model, and they're using the onion model as an example. Okay, we move to the next slide. If you look at the principles of self-organization, I think all those systems we build based on management ideas, based on new public management, they create a lot of distrust. And what I think is we should build on trust. So we should say, and not, you can say it's a little trust. No, it's trust or not. So, and we should accept also that things can go wrong if you build on trust. So there are mistakes always. That if you are doing things in a complex environment, it's always trying to find the best way, but things can go wrong, but that's not a problem. Let's learn from it. So we said that there is optimal autonomy for the nurses, and there is no hierarchy. Try to avoid hierarchy. We also said if everybody can understand the daily routine, and if you also can understand how things work, then everybody will take responsibility. So reduction of complexity is a very important thing. Simplifying things, that's what I think what's that we very good at. And so because the systems, all the healthcare systems all over the world are creating a lot of complexity. And we said, okay, then not just do it, but discuss it. So we said, if we are asked to do things by the, for example, by the health insurance, from which we think it's not useful, then we are not going to do this. Then we are arguing it with the with the health insurance, and we say, okay, for this reason, we are not going to do this. And usually, at the end, they agree. So it's also just not just following orders or following guidelines or protocols. The teams, people are quite high educated. So we have a lot of registered and bachelor nurses. They have their own education budget. And we said these informal networks, which I mentioned before, are so important. If you have a good relationship with the doctor, if you have a good relationship with volunteers in the neighborhood, then you can achieve so much more than what organizations can achieve. So it's all about personal networks. So if you have a team of 10 people who all have 10 networks, then you have 100 networks. So, and it's impossible for an organizational structure to organize this. So this is an idea about it, the whole network idea. Okay, we move to the next slide now. And the next slide is about, I already said, the back office. A back office is very simple, and but a lot of people who are also very, very supportive to the teams. This is about the Buurtzorg web. If you look at the idea when we started in 2006, we said it would be good that we create a community with our clients and with the nurses. So now, at the moment, the clients are participating with the teams in their care plans. So they can, and the families, they can discuss things which are happening with them. Family members, even if they live far away, they can be involved with what's happening with their father or mother. But the instruments we use as this Omaha System I mentioned before gives a lot of transparency. So it shows what the results are of what we are doing. So we said we measure the behavior and the knowledge and the status of people, and it gives a lot of data. So it's all integrated in the system. We also communicate in the care chain, so with hospitals, doctors. There is a lot to do still, but more and more we are exchanging information with the on the web. Then, of course, we have all the things like the administrative things, so the billing and the salaries, the production. That's the grip on the business. But it always starts with the relationship between the professional and the client. So this is about Buurtzorg. There's a lot of things to tell. We started our own IT company in 2007. And at the moment, this IT company is also supporting a lot of other clients, a lot of other organizations in Holland. The next slide, please. Besides buurtdiensten, which I just mentioned, where more than 4,000 care workers are working, we started a lot of other services which have the same principles. So maternity care, youth care. We are doing the youth care in some villages in Holland, who said we have a lot of trust in your principles, so can you organize youth care in our municipality? We build hospices, we have pensions. Pensions are places where people can stay for a few days, a few weeks, and then after that, first they recover and after that they go home. We have collaboration with physiotherapists and occupational therapists, Buurtzorg Plus. We have also one of the most fast-growing parts of Buurtzorg is Buurtzorg T, and that's the mental care. So psychiatrists, psychologists, psychiatric nurses, and so on. So all these parts are built on the same principles, working with self-organized teams and having great results and great outcome. Next slide, please. Yeah, this is what I already said. The overhead costs are very, very low. I think the lowest in the country. The average in Holland are 25%, and the you hear the animal drinking water now. We have just a puppy a few days, so that's on the background. It's nothing serious, and we are financially sustainable. So with this not-for-profit organization, we said, okay, how can we do it in a way that it's also financially healthy? So I already explained the financial model we have, and every year we have just a little profit, 1 to 2%. If we have more, we say everybody gets a bonus, an extra payment at the end of the year, and that's what we do year by year. The next slide, please. If you look at the results on the scale of Holland, then a lot of people were surprised by the outcome. So we did 2 big researches, one done by Ernst & Young and the other by KPMG. And they both showed that we had 30 to 40% less hours. And you know, when one of the big problems we have in Holland and in Europe, I think, is how do we find enough nurses and capacity to take care for the growing population of elderly? So I said, if you can save 40% of the hours, you have less pressure on this capacity. So we were supported by a lot of political parties, and we work very closely together with the ministry. And from the start, we also got attention from a lot of other industries like banks, but also schools. So we are also working with schools who want to change their organizational model into more self-organized teams with teachers, and that looks, I think, a bit familiar with the Finnish system. So the next slide, please. If you look at the current situation about COVID, what we saw was that by this organizational structure we have, we could very easily adapt with what was happening. If you look at the government, from the start they said, okay, we're going to do this top down, but the way they did it was, I think, not right. So we argued the Dutch government because they aimed at scarcity. And that led to a lack of protective equipment, a lack of tests. So I think it was chaos in March and April. They focused on hospitals, so no protection for nursing homes and home care staff, and setting up a central distribution which didn't work. Next slide, please. If you look at our own approach, we said from the start, we have partners in China. So we saw in a very early stage what was happening in China. So we said, okay, we have to prepare ourselves, and we have to create our own distribution center. So from the start, I think it was February, March, we set up an airlift for protective equipment. We advised all our colleagues to wear first homemade masks, and we said, okay, when it's needed, we will have professional masks like this FFP2, which they use in hospitals. So we had a lot of materials ourselves. We even provided a lot of materials to our colleagues, organizations who, in nursing homes, I think in some other countries we saw the same, that at a certain moment there were so many infections and so many people were dying, and they didn't have any material. So we said, okay, you can have it from us. And we were explaining in the media that this strategy of the government led to the shortages. So we didn't have shortages. So there were, and we organized our own testing capacity. So we just, with a laboratory, we said, okay, what can we do ourselves? So with our own approach, I think we made an exception in Holland. We were first more or less accused by the inspection, by the government, by taking away materials from the hospitals, and said, no, that's not true. We should follow another strategy. Okay, that's about this COVID. I think there is another slide about this. And the next one. Yes, I think what also was amazing was our crisis team. So we formed in an organic way. It was not a project or something, but we said, okay, what kind of people do we need? And for example, we had an epidemiologist, difficult word, and we had experienced nurses. We had we didn't give any orders, but we asked the teams, because we are working all over the country, what do you need? What kind of topics are you dealing with? So we had a 24-hour crisis team who was giving answers on this. And then we built our strategy based on what was happening. So, and we said we should have a preventive attitude. So we don't know so much about this virus, so let's be careful. So we have to deal with vulnerable people. Let's wear masks, be safe, and focus on well-being and solidarity. So we were having meetings every day with this crisis team. We were in a flow, and I think the teams now say that they were so happy and proud that they were supported so well. The next slide. Okay, this is about innovations. I'm looking at the times. Okay, we're still in time. We are developing innovations every day. So we said every nurse has good ideas. So, and let's give the opportunity to develop these ideas to new innovations. One of the most beautiful ones is in the corner left under, yeah. That's the walker race. So one of the patients who was 86 in Amsterdam said, there are competitions for everybody, but not for us elderly behind walkers. So this nurse, Marjolein, she said, I'm going to organize a competition in Amsterdam. And it was 10 years ago. And it became a big success. So at the moment, we have a national event in the Olympic Stadium in Amsterdam. And this whole idea spread all over the country. So everywhere in villages, in cities, people are doing these pre-competitions. And then once a year in the Olympic Stadium, you have a competition on the 400 meters, 800 meters, 2 kilometers. And it's amazing what the results are. So people are feeling that they still can do competition. The eldest one last year was 104 years old. And you know, these people, the difference in the feel that you are vulnerable and that you can't do so much, but these are people who are really doing a competition, who are 104, and these grandchildren were so proud that their grandmother is doing this and getting this medal. And it's also very funny to see. Okay, the next slide. This is what happened since 2010. I think in the first years, this growth with this many thousand nurses who were joining Buurtzorg had a lot of attention, got a lot of attention from people in other countries, from ministries, from healthcare organizations, and so on. So every time people ask me to talk about it, and I went to Japan, I went to the US, traveled all over the world, and every time the idea was the same. Nurses understood it. they were very eager to start something. Also, ministries understood this. I remember the meeting with the Finnish ministry, who was in The Hague, talked with the Finnish minister. And one of the questions she asked me was, how is it possible that we made it so complicated? And then she had, I think, 8 people from the ministry with her. And I said, as a joke, I think it's because of these people. But of course it's not. But you know, the way we make policy and the way we develop systems in healthcare, there are so many interests and so many people who are developing something without knowing what the consequences are for people who have to work with it every day. So my idea is all the time to please turn it around. Start with the people who are doing this work every day. Ask them, what is the best possible way to work? How can we avoid bureaucracy? How can we make it less complicated? How can we focus on results and outcome? And how can we make the work as inspiring as possible? And that's understood by so many people. So what we see is that in all these countries, we have partners who start. We just, a few weeks ago, we started with Brazil. We have now Buurtzorg in Acapulco. So I think it's funny to say from a small country like Holland is, that we now have influenced the healthcare in Brazil. Amazing. So the next slide, please. I think this is one of the last slides. We, based on the many questions we built an international team. This international team is also supporting our partners in different countries. In Europe, we have partners in almost every country, and it's amazing how it develops. So the coming years, we will put a lot of effort in supporting this and building an international network where people can exchange knowledge and experiences. And at the end, what we want is that if people want it, that we, as many as possible people, can have support in a way that it's human, it's humanized, and it's creating a lot of humanity instead of bureaucracy. So I think we go to the last slide now. This is, I think most of the things I already said. We build relationships like we are doing with patients based on trust, and at the end we create a license agreement with partners. And I'm very proud that of last year we also have a very good partnership with our Finnish partner. So, and I hope that the ideas will grow in Finland, as in a lot of Scandinavian countries. And I think we also can learn a lot from your country, because the way you are dealing with some problems are, I think, an example for a lot of countries in the world. To the next slide. So I think this is something you can read. I think this presentation can be spread, but I think these are 10 lessons. These are things we find that are very important. Every time again, we said start small, learn how it works, no pressure, seduce. It's always about the relationship between the professional and the client. Everything else is less important. It is important to think about a good business model. I think we learned that only focusing on the healthcare part is also not good. You should find a consistent way to, on one hand, take care for the healthcare part, but on the other hand, how do we build a framework where there is enough freedom, but there is also a consistent way of dealing with the problems you face. So it takes time. So it's not in just a few months done. That's also what the partners see. It takes some years. You need people around you with an open and positive mindset. So also the back office, how you build the back office is very important. And believe in that things will develop by itself. Okay, this is, I think, the last slide. Then, or not. Let's move to the next slide, and then we can see. Okay, yeah, I think this is things. Our people are not suited for self-organizing. Yeah, that's always said by the bosses, by the management. Best of both worlds. I think it's not possible to build on different paradigms. It's also not easy. Just fire managers and tell the teams themselves that would not be good. And it can be done without restructuring. Now, also the back of have to be restructured. And what we have in the first years, it won't work. It's just a hype. I think after 15 years, showing how it still works, I think it's not a hype, but it's looking at how do you look at people? Do you think that people are able to organize things themselves? And isn't it time to be more critical about the current management systems?